Which of the following allows debris to be removed from the lung? A. The mucociliary escalator. B. The pleural lymph system. C. Bronchiolar constriction and dilation. D. Granulation. The answer is A. The mucociliary escalator. The system by which debris is removed from the lung is termed the mucociliary escalator. This is made up of two parts, the mucus produced by respiratory goblet cells, and the wave-like movement of cilia covering the bronchioles and bronchi of the lung. Bacteria and particles of debris are caught in the mucus coating the cilia, which is then passed in waves upward toward the trachea. Once it clears the trachea and enters the pharynx, it can either be coughed out or swallowed. The major alveolar cell type, making up 95% of alveolar cells, is type I. Only 5% of alveolar cells are type II, yet they serve a vital function in respiratory physiology. What is the function of type II alveolar cells? A. They are the site of gas exchange. B. They secrete surfactant. C. They nourish the type I cells. D. They are important for the integrity of the alveolar connective tissue. The answer is B. They secrete surfactant. Type II alveolar cells secrete pulmonary surfactant, a lipoprotein complex that is essential for lung function. This surfactant acts to break up the surface tension of fluid coating the lung air spaces, allowing for alveolar compliance and reducing the buildup of fluid in the lung. Lack of surfactant can lead to atelectasis, or collapse of part of the lung. Which of the following is the primary muscle of respiration? A. The intercostals. B. The scalens. C. The sternocleidomastoid. D. The diaphragm. The answer is D. The diaphragm. The most important muscle of respiration is the diaphragm, followed by the intercostals. The sternocleidomastoid and scalens are considered accessory muscles of respiration. How do bronchioles respond to an increase in the partial pressure of carbon dioxide in the alveoli? A. They secrete mucus. B. They constrict. C. They dilate. D. The bronchioles do not respond to changes in the partial pressure of carbon dioxide. The answer is C. They dilate. Carbon dioxide has paracrine effects in the airway, causing the smooth muscle of bronchioles to relax. When the partial pressure of carbon dioxide in the alveoli increases, the bronchioles dilate. This allows for increased ventilation. What nerve innervates the diaphragm, necessary for normal inhalation? A. The intercostal nerve. B. The phrenic nerve. C. The subcostal artery. D. The vagus nerve. The answer is B. The phrenic nerve. The diaphragm is innervated by the phrenic nerve. This nerve exits the spine at C3, C5. In the case of spinal cord trauma, if injury occurs above C3, the diaphragm is no longer able to function on its own and breathing assistance is generally required. Which of the following terms describes the maximum volume of air a person can exhale after maximum inhalation? A. Functional residual capacity. B. Residual volume. C. Vital capacity. D. None of these. The answer is C. Vital capacity. Vital capacity is the maximum volume of air a person can exhale after maximum inhalation. Residual volume is the air that remains in the lung after forced exhalation, while functional residual capacity is the volume of air that remains in the lung after a relaxed exhalation. In the average adult, how much air remains in the dead space of the lung after normal expiration? A. 250 milliliters. B. 750 milliliters. C. 150 milliliters. D. 70 milliliters. The answer is C. 150 milliliters. Dead space is the volume of air that remains in the trachea, bronchi, and bronchioles during respiration. It does not enter the alveoli and so does not participate in gas exchange. In the average adult, the amount of air left in the dead space after expiration is 150 milliliters. What is the average volume of air breathed into and out of the respiratory system during tidal breathing? A. 1,200 milliliters. B. 1,000 milliliters. C. 500 milliliters. D. 750 milliliters. The answer is C. 500 milliliters. Tidal breathing is the term for relaxed inhalation and exhalation, as opposed to maximum inspiration and forced exhalation. The average volume of air breathed into and out of the respiratory system during tidal breathing is 500 milliliters. Which of the following would cause bronchoconstriction? A. Cold air. B. Allergens. C. Parasympathetic input. D. All of these cause bronchoconstriction. The answer is D. All of these cause bronchoconstriction. There are many factors that can cause bronchoconstriction. Some of them are normal physiological responses, such as parasympathetic input or decreased partial pressure of carbon dioxide in the alveoli. Other causes are pathological, such as allergic bronchoconstriction or asthma triggered by cold air. What are the two types of alveolar cells? A. Interstitial cells and active cells. B. A cells and B cells. C. Type 1 and Type 2. D. Primary and secondary cells. The answer is C. Type 1 and Type 2. There are two types of alveolar cells, Type 1 cells and Type 2 cells. Each cell type has a unique function within the alveolus, and the dysfunction of either cell type results in serious respiratory pathology. Type 1 cells are simple squamous epithelial cells that account for about 95% of all alveolar cells. They are the primary cells responsible for diffusion of gases across the respiratory membranes. Type 1 alveolar cells are responsible for secreting surfactant, which facilitates the diffusion of substances across the epithelium.